Film with family. They love the family, they love the movies.
Hello and welcome to Film with Family. I'm Austin.
And I'm Zach.
And we are two cousins who like to talk about movies. And today we are discussing our first documentary feature film by the one and only Michael Moore. And we're talking about the film Sicko from 2007. And with us today to talk about Sicko, we have Dr. John Zweifler, MD, MPH.
LLC. Hey,
Uncle John.
Hey, good to see you guys.
Welcome back to the podcast.
Thank you. Thank you.
Listeners will remember you from our famous Oppenheimer episode. And it's great to have you back for season 2.
Well, thank you. And I listened to your Oscar podcast, and you panned Oppenheimer a little bit. And, there's some parts of it, as we talked about, that I really liked. But to think of it as the best picture of the year when the last hour and a half could have been cut was, it's just like, geez.
Thank you.
Well, I liked that they talked about meaty themes and approached it in a humanistic way, and got you thinking. So more of an intellectual film, and all that is I thought was great. And then I like timepieces as well, and so you got a sense of what it was like then. And but just as a movie, it was just, geez, why did you subject us to that last hour? That just. Extraneous, as we would say in medicine, if you're born with a 6th digit, it's supernumerary. So that's what I thought about that.
So you're calling Oppenheimer supernumerary? Wow.
Yeah.
Let's keep it PG, John. That's a little explicit for this podcast.
Yeah. I'm talking about fingers, okay? So let's be clear.
Oh, speaking of fingers play into this movie Sicko quite a bit.
Yeah. Fingertips. Yeah.
But before we get into the movie, Dr. John Zweifler. Dr. John is a family physician with extensive leadership and administrative experience in medical education, quality improvement, and healthcare delivery. You have provided care in some of the most impoverished communities in America, ranging from shuttered factories of Flint, Michigan, which is Michael Moore's hometown.
Yeah. So
I was just curious what the story is there.
That was when I was a resident. So the journey to become a doctor starts at kindergarten. So the high school, got to go through college, and then you go to medical school, which is an additional 4 years. After that, you decide what type of physician you would like to be. So cardiologist, pediatrician, anesthesiologist. I was interested in family medicine. You go to, at that point, you match to a residency program. And I ended up going to a residency in Flint, Michigan. So that was another 3 years of my life. And then stayed on there for 2 years to work at a community health center in Flint, Michigan, called Hamilton Avenue Family Health Center. Two really satisfying years of my life, and so a total of 5 years in Flint. And I remember when I moved from Flint to Fresno, California, there was an article in the Fresno Bee talking about the high rates of unemployment in Fresno, which are related to migrant workers, seasonal agricultural workers, Fresno being having the highest unemployment in the country, one step ahead of Flint. So yeah, I think I can say that I've worked in impoverished areas. So
yeah, interesting.
Yeah, but fortunate to be a doctor and to be able to contribute in some way, and at the same time lead a happy life that's well remunerated.
Mm-hmm. And you're
reporting maybe.
You're reporting from Fresno right now, right?
So I'm back in Fresno. Spent the last month in the Midwest. Got to visit with my mom, your grandma, Grandma Ruth, for a couple weeks, and visit with uh, Zach's family, and great to see the multi generations. And also got to see you, Austin, briefly in Chicago, and
Yeah.
Aunt Rian. So Michigan, Illinois, and then a couple weeks in Wisconsin as well, in a rural area. So it was a good trip, and one of the very few good things about COVID was really opening up the opportunities to work remotely and virtually, and so I was able to continue to do my various activities, and at the same time get to visit. And that was
Yeah.
a good month, but nice to be back here. It's sunny and 65, and a beautiful time.
Yeah, I appreciated your attendance at my music show with Kimmy and Kale played a music show in Ypsilanti, and you're one of the few attendees showing support, and I appreciated that.
I was hooting and hollering. I enjoyed it. You guys are good, and a very talented musical family. And speaking of that, I was hoping to hear the intro to Film with Family that was done by my son Troy, and as you know, Troy is not really prone to public displays of affection. But there was a one day I heard him, and his door was closed, but I kept hearing him saying, "Love my family, love my family, family, family." Whoa, Troy, this is a real change of pace for you. And, but it was all for you guys. I was what a letdown to know that it was just solely for commercial interest. Yeah. So anyway, I felt sullied somehow. But yeah.
You thought he was you're eavesdropping on like some private
Well, I thought maybe
extolling of his
I
heart.
thought he was trying to reach out to me in some kind of way. But anyway, I found out the truth is just to help his cousins along and make a few invisible bucks. Or
That's so funny. So yeah, speaking of invisible bucks, part of your attendance here today is for promotional purposes. You, among your many talents, are an author, and you've written a few books now, including Pop Health and Management for Nerds, which I think is a funny title. I don't know what that is about necessarily. Um,
Well, Austin, you shouldn't feel bad, because I would say probably nobody knows what it's about because no one's read it. So in terms of your comment about invisible bucks, very true. So
Well, John, it's the blind leading the blind here because nobody listens to this podcast either.
all
So,
right. We're in an endless loop then, I guess. And just
Yeah, screaming into the void.
right.
But yeah, you've written several books, and one of those books is a book that's, I guess, now a series called Tipping Healthcare.
Yep, tipping healthcare in the right direction in 2020, and then I revised it in 2022. So it's currently you can find it on as we speak this minute. You can find it on Amazon, but I'm revising it to do Tipping Healthcare 2024, and we'll be releasing that in the next several weeks. So for all those who are stampeding to get their computer and purchase it, please wait 2 weeks and get the updated version.
Well,
Do
when
you
is
have like
it?
a specific date?
No, as soon as the person I'm working with can get it formatted and copyrighted, but it's very close, and yeah, I feel good about it. It captures my thoughts. I've called the first one "Tipping Healthcare in the Right Direction" because I believe we're at a tipping point in healthcare, and it could. If we look at history and what's happened in the past, usually these events lead to massive profits for a few, and the rest of us with too much benefit. But alternatively, I think we could have a much more vibrant, integrated healthcare delivery system that we could all be proud of. So the explicit tie-in to Sicko.
Yeah.
And I guess I could explain my tie-in to Michael Moore too. We're talking about Flint, and so yes, we did cross paths when we were in Flint, Michigan. So at that time, Michael Moore was a writer and a journalist, and he
What year is this?
This would have been 81 through 86. And then we were together in a group called the Flint Alliance for Peace. And so that's where we met, and we got to know him pretty well. And at that time, he also was trying to produce his first movie, Roger and Me. And so he was looking for folks to contribute to, get him over the finish line in producing that. And so myself and my wife at the time, Sue Stone, we contribute a little bit of money. So if you see Roger and Me, you'll actually see our names at the end of that. And although I must say, since then I have tried to reach out to Michael on occasion, and I feel similar for those who saw Roger and Me. It's about Michael trying to interview the head of GM, the CEO, to talk to him about union rights and worker rights, and he finally gets there. It's kind of like a Wizard of Oz sort of pursuit, and but he was more successful than me. I've yet to actually contact Michael in the interim, but I have great respect for what he's done and what he stands for.
And our grandparents, your parents, contributed to Roger and Me as well, right? I think Grandma and Grandpa are in the credits as well. Am I correct
I
there?
thought that was the case.
That
Yeah.
may very well be. Yeah.
So I think that's it. And I actually have something. So a few years ago, when I was at Grandma's house, I stumbled across this VHS tape, which is the Roger and Me sample footage. It's 13
Okay.
minutes, and it says director, producer Michael Moore. Do you have any recollection of this kind of like VHS preview tape?
No, I don't.
Okay.
No.
Well, it must have been something that he sent to either Perspective or people who had contributed to the film in some way. But I was scouring the earth today to try to find a VCR in my proximity so I could see what was on this tape, but I still haven't. Maybe if I get to watch it sometime between now and when we publish it, we'll add a little addendum as to what's on this mysterious Michael Moore tape.
All
But
right.
I got to imagine it's probably just some footage that's actually in the movie. But who knows? Maybe he gives a little intro. Maybe he personally thanks you or something. I don't know.
Yeah, I remember there's some story of Caleb and Grandma like going to FedEx or something and running into Michael Moore, and Michael Moore like recognizing Grandma, and they had like a little interaction.
Really? That sounds like a call out.
We could call out Caleb, see if he remembers this.
Call him.
Well, yeah. Well,
Call him. Call
yeah,
him.
do it.
This is I'm calling Caleb.
Call out.
All right, let's do it.
Caleb, we're recording Film with Family, and we're talking about Michael Moore, and I was wondering if you remember the time you ran into Michael Moore.
Yeah, I do. I was going to Kinko's in downtown Ann Arbor. I believe I was with Troy. I forget what I was printing out, but yeah, I just was going out to pay for some kind of printout service, and I saw. I mean, I guess he doesn't have a super distinct silhouette, but I like, he was talking to the guy, and I'm like, I'm pretty sure that's Michael Moore. And so I said that. I think I probably said, like, I'm pretty sure you're Michael Moore, and I forget what he said. I think he said, I get that a lot, or something kind of. Sort of, he shook my hand, and I was like mentioning how our family helped, like Grandma and Grandpa contributed to the making of Roger and Me, and he kind of acknowledged that and didn't make too big of a reaction to it. I'm not sure if he didn't know what angle I was going for, but because I think from what I recall, Grandma remembers contributing to it, and then she reached out to him in regards to some issue that was going on, and maybe he never responded. But yeah, it was cool bumping into him. He was friendly, and I think he was printing out like Obama. It was an election year, and he was trying to get like college students excited about like actually showing up to vote because it was going to be a close one. Yeah, that's pretty much it.
Wow.
Yeah, that's all I can remember.
All right. Thanks for the call out.
It's a call.
Thanks, Caleb.
See ya.
Boy.
Yeah, I've actually run into him. I ran into him at the Women's March in Washington, D.C. He spoke there the day after Trump's inauguration. I was there actually shooting some documentary footage. It was kind of a full circle moment for me because I kind of started doing documentary being inspired by Michael Moore. And then I was in DC shooting a documentary, and like all of a sudden Michael Moore is like lumbering towards me. And I was just like, I was like shooting him, and I was like, oh my God, there's the man himself. But yeah, I mean, with all these stories about him, you know, or you guys contributing to Roger and Me, and him being a Michigander, as we all are, it's just, it's interesting. He's kind of felt very close in a way. It's interesting. I mean, he's such a towering figure now, I think, as like a political activist, as a documentarian, but somehow feels like very close.
He's a guy.
Yeah, he's a guy in Michigan, you know, like, I mean, he's very vocal about his love of being a Michigander, and
Wearing a lot of Detroit hats and Michigan State hats in his movies. 'Cause he went to MSU, I believe.
yeah, but to bring it back to before we start talking about the movie, I do want to talk a little bit more about your book, John, and um, you know, you talk about these three trends in healthcare, and I was wondering if you could kind of discuss that in like what the social determinants of health are, the SDOH that you talk about in your book.
Yeah, so tipping healthcare, it talks about three trends that are driving healthcare. And the first is the continued growth of value-based care with its emphasis on both cost as well as quality. The second is the availability of digital solutions to increase access to care. And the third is the emergence of population health as a more holistic approach to health that encompasses social determinants of health. And so all these things are happening. And, you know, I wrote this first in 2020, and it was true in 2022, and it feels even more true in 2024. Continued growth of value-based care. Medicare, over half of Medicare recipients now are on what are called Medicare Advantage plans, which are value-based care plans. And the way they are different than the past, and it ties into some of the themes in Sicko, is they are managed care, in that cost is a significant issue. You're paid a certain amount per member per month, and so you're supposed to manage the cost of your patients. And under the more traditional fee-for-service system, you know, the more you see, the more you do, the more you make. And with managed care, it really changes those incentives 180 degrees and has a dramatic impact. And in ways that can be, I think, positive as well, in terms of looking at ways to be more efficient and more team-based approaches. The digital solutions component, I mentioned I went back to Michigan and Wisconsin, and I'm able to do that virtually. And there's a lot of other things that can be done virtually now as well. One of the activities that I'm involved with is working at a needle exchange, and we're providing what we call low barrier medicated assisted treatment to patients. And so we get referrals about folks who are using heroin or fentanyl or meth or alcohol, and they want to stop. And I can get referrals from the emergency room or from a small town 60 miles away and deal with it over the phone. And these are folks who often have a lot of issues with getting in to see the doctor and unstable kind of lives. And it's a really efficient way to deliver those services. So a lot of opportunities to increase access to care using digital solutions, using our cell phones, text, e-consultations, a whole range of things. And it also ties into this idea of value-based care. How can you deliver care more efficiently and effectively? And population health as a more holistic approach to health that encompasses social determinants. Social determinants are the conditions under which you are born and live that are shaped by money, power, and resources. And so one way you can think about that, think about money and wealth. And so in the United States, if your family is white, you have 6 times as much wealth as a family that's Black. And I think we can all imagine how our lives would be different if our families had 6 times as much money as they do. It just had, very dramatic kind of impact. And so it impacts housing, food, transportation. And these are kind of, we consider more social services, but they also impact your health in rather dramatic ways. So in general, the more educated you are, the more income you have, the better health you are. It's a very consistent connection. So if there's ways that we can address some of these social determinants in conjunction with our healthcare, we have an opportunity to improve health generally. So anyway, there's a lot of different directions with it. I'm involved with public health, and public health is a type of what we call population health, and trying to keep people healthy, like access to healthy foods, physical activity, et cetera. There's ways that through public health and population health to improve health of populations in a more efficient way than trying to do it through our individual healthcare system, where you have to go to see the doctor and do it one at a time kind of thing. So, but we currently spend 97% of our healthcare dollars on individual healthcare services and only 3% on public health. And if we change that and look more at how do we better connect individuals to services, they'll better connect our healthcare providers, governmental agencies, community-based organizations. I think there's real opportunities to have a healthier society.
Yeah.
So that's what it's about. And it also talks about community health workers and, how do you better connect individuals to services, both at a community level and then also in doctors' offices, less about, okay, what medicine do you use, but more about how do we make sure that the patient is getting the services that they need. And particularly for those who are lower income, transportation issues, those kind of barriers, making sure that they are making it to the specialist appointment, so that rather than all the barriers that are described in Sicko, that we really try and overcome those and really help people get the care they need. And that doesn't need to be the doctor. It really involves having folks in the offices to really assist patients when they have healthcare issues. So that's what the book talks about, is how can we maybe build up that infrastructure so that patients are better able to access healthcare services and better connect to kind of this whole social service network as well when needed.
Do you have like an optimistic view that healthcare can get better in this country, or do you think it is getting better? Is like kind of what the book's getting at?
Well, it's at a tipping point. And so even with some of these services, we're seeing that community health workers can be reimbursed for services. And there's other programs that can pay for what are called chronic care management services. But a lot of times these are done as a for-profit entity and not necessarily integrated into the doctor's office or in a way that really connects people in an efficient manner. And even as we make progress there, it's still okay. Is it a way for a few people to make a lot of money, or are we really looking at it from a more holistic approach so that we really provide the services in the most efficient and effective manner that benefit all of us? And part of it's a distrust of government generally, and we're certainly seeing that today. A distrust of vaccinations, even as we're seeing measles reemerge, and so we have to overcome that to think we're stronger when we work together than when we try and do everything individually. And so it's about how again, how do we kind of develop networks and again do things in more efficient and effective manners.
So yeah, that's going to be my next question is, because when you talk about involving the government, obviously everybody runs away screaming socialist. Do you believe in a Medicare for all system, or is that where you think that we can go? Do you think Medicare for all is realistic?
Yes, I do think Medicare for all is realistic and makes a lot of sense. And there's more people on Medicare and Medi-Cal government systems than there are in the private or commercial plans. So it's already a huge part of the healthcare delivery system. Medicare it's already out there. It's a platform that people understand and are used to, and so it's a matter of building on that. And if everyone was covered, it would just be so much simpler. Now you've got this insurance or that insurance, so a lot of money is spent on just the kind of the billing aspects and all the kind of administrative and bureaucratic hurdles. And up to 15% of healthcare dollars goes to those kind of things. Whereas in countries that have a national health system, like in Sicko, where they go to France and Britain, and you're not having to do that. You don't have to have these billers and coding and all those kind of things that at the intensity that we have in the United States. So the overhead for Medicare is a few percent, whereas again with commercial plans it's 15% or something like that. So kind of instant savings.
What do you say to people that say that it's not affordable to do that in our system, like that we'll be taxed out the wazoo? And
yeah, and I think this is where we run into issues generally, is somebody is paying for it right now. And so go try and buy health insurance right now. The total cost of healthcare in this country is close to $1 trillion. Healthcare is the largest element of our GDP. So we spend 17% of all dollars in the United States are related to healthcare. It's bigger than defense. It's bigger than retail. It's it's bigger than film with family. I mean, so it's huge. And so
that's for sure.
Yeah.
We gobble up about 2% of the U.S. economy.
Right. Yeah. So I mean, just for each person, it's like 10,000 a year. It's mind-boggling. You can't even wrap your head around how expensive it is. And so somebody's paying for that now, but now it comes out of your paycheck, or your employer subsidizes it, and it goes and causes prices to be higher, et cetera. So you could provide that same healthcare, I think, more efficiently and effectively if you had a Medicare for All system. So it's just that you would see all those dollars in one bucket, as opposed to now where they're spread over different buckets. And similarly with trying to develop networks of, say, community health workers to connect individuals to behavioral health, social services, housing, et cetera. There's upfront costs in terms of doing that, and we have to develop a kind of a good networking system, information exchange type system. But if you keep a few people out of jail because of this, you help a few people get into education, stabilize their lives so they're not receiving food stamps, et cetera, and instead they're paying taxes. You look at that overall bucket and you start to see where there's real opportunities to, again, having a more efficient and effective system. And even within healthcare, where you have folks who are homeless or struggling, they have trouble accessing healthcare services, they end up in emergency rooms, or they're sick, they end up in the hospital. Very expensive. So if you can reduce those by keeping them out of the hospital, and there's opportunities for savings in that regard as well. So we're paying for it one way or the other. We just don't want to think about it, and because they're in different buckets, it's harder to wrap your arms around it. But I think if it's approached at a community level, that's the best opportunity. That most your healthcare services are local. Your community-based organizations that provide services are local. So cities or counties, I think, are the most logical kind of unit to build these networks of care and fill in the gaps that occur now. And I think there's an assumption that everyone knows where to get services and how to access services. And in my experience working in the healthcare field, it's just not true. That there would be huge benefits from having individuals such as community health workers who only require a high school education, who have lived experience working with the populations that need it. So they speak the same language, they've had similar backgrounds, they can relate to the individuals they're working with, be it if justice involved, or folks who've had substance use or behavioral health issues. If they're speaking with someone who speaks their language, then they're much more likely to relate and to be able to follow through on some of the recommendations. And similarly in healthcare offices, instead of just the doctor running around and the nurse putting patients in room, that there's someone there who can really help the patient make sure that if they needed a walker, or that they understand this, that what specialty care they're going to get, or that this is where they're going to go to get their lab, and this is how it's going to happen, and to talk to them and educate them, it would go a long way. And not everybody needs that, but for those higher risk patients, it can be of huge value, both to the patients as well as to the doctor as well.
Yeah, you kind of broach this topic, defund healthcare, kind of going off the defund the police motto. Is that kind of what you're talking about? Is reallocating the funds to
Yes.
community-based stuff and more specific groups, specialized groups?
So, yeah, defund the police, what's that about? And of course, if you're having trouble and someone's harassing you, you want a policeman there. And so they absolutely have a role. But police are also often put in situations where they're dealing with social situations. So, for example, if you have a psychiatric crisis, then you do what's called a 5150, and that can be signed by a policeman. But the policemen don't have any particular kind of expertise in psychiatric issues. It would support the police to have a behavioral health person when they're dealing with those kind of situations. And it's starting to happen. That's why I call it tipping healthcare. It's not like any of these ideas are new. They're happening now. And rather than thinking of it just as a security issue and law enforcement issue, it's like, well, this is a multifactorial situation. Let's look at some of the root causes. How are we going to deal with this in a way that, and how can we diffuse this situation and have a better outcome? And so having a behavioral health person be involved in those type of situations makes a lot of sense. So similarly with healthcare, again, I mentioned that 97% of our dollars go to individual health services. Well, so we took a couple percent of that and redirected it towards addressing some of these social determinants, developing these community health networks, connecting people to services for food, housing, transportation, and is putting more money into public health. So we have access to healthy foods. We don't have these food deserts. We build bike trails, walking trails where people can get physical activity. So investing in those kind of things would have a great impact on health. It's just not as easily kind of quantified as it is when you're talking about an individual.
Well, let's kind of use this framework of your book to discuss this film, Sicko by Michael Moore. So just to give it a little bit of context, at this point, Michael Moore is a very controversial, probably the most famous documentarian in the world in 2007, and had won the Oscar in 2003 for Bowling for Columbine. And then 2 years later came out with Fahrenheit 9/11, which was a gigantic film, kind of exposing the 2000 election and the subsequent Iraq war after 9/11. And then 2 years after Fahrenheit 9/11 came out with Sicko. So up there with guns and the Iraq war. Next up was healthcare to tackle this huge issue. And I wouldn't say this movie was as successful or as big of a smash as Bowling for Columbine or Fahrenheit 9/11, but just rewatching it yesterday, I mean, I think it's still just an incredible documentary. I mean, he does such a brilliant job of painting these various portraits of people at different levels of need in healthcare. So watching this, John, like this movie being almost 20 years old compared to now, what stuck out to you?
Yeah, well, that a lot of it still rings true. Health is so central to who we are. I work at the health department. There's a sign, walk up the stairs each day. I'm on the 6th floor of my office. So when I walk up, there's a sign that says, "Health is the first wealth," from Ralph Waldo Emerson. And yeah, it's really true. We take it for granted, but boy, if something happens, everything changes on a dime. Nothing draws you up faster than a medical issue. And everything else stops. When someone cuts their finger, like happened in the movie, or someone develops cancer, what a scary disease, cancer, the crab, you never feel like it lets go. These are very personal and visceral, and I think all of us can relate to. So I think Michael Moore does a really good job of capturing that, and the kind of the angst that goes into dealing with healthcare, a medical issue, at the same time that you're concerned about your healthcare coverage. And that, you asked about Medicare for all. I mean, just the healthcare, it's so confusing and intimidating. And, here you are at this really vulnerable point, and it's so incredibly expensive. So the copays and deductibles, and is it covered? And, did I go to the right doctor? And, there are all these questions that you really shouldn't have to think about. And there's certainly a danger of, unfettered kind of access. So, okay, that, how do we afford that? Or, everyone just goes to the emergency room every day. But if we had a Medicare for all system and we really focused on providing access in a kind of a seamless process, that a lot of those issues would take care of themselves. But because it is so expensive, because it is not seamless and not easy to access, that there's just a lot of fear and anxiety around calling up your doctor or going in. And again, I think he captured that well. He did a nice job comparing it to other countries. When we talk about social determinants of health, you look at other countries, they do not spend as much money as we do on healthcare. So we spend 17%, in places like France or Canada maybe spend 10 or 11%. And but they spend more on social services. And so he really drove that home when he's talking about France, and that they were going to help them do their laundry and things like that. Just kind of more of this safety net that's out there, that to thinking about health kind of in a broader sense. It's not just about the medical aspects; it's the other components. I thought he did a really good job of portraying that. At the same time, there are some things that have certainly changed. One of the more dramatic, or it just seemed so far-fetched, was the woman who was denied health insurance because of a yeast infection, which probably every woman in the United States has had at some point. And and so that no longer is permissible. So
yeah, I wanted to ask about that. So did like the Affordable Care Act change that? Like being able to deny people
and I'm not a historian. I'm not sure exactly when that got fixed, but that no longer is the case. And so certainly for Medicare and Medi-Cal, there's no pre-qualifying kind of process. For individual health insurance, your costs may be higher if you have more conditions in some situations, but in general, it's no longer the case that pre-existing conditions are going to impact that your insurance can be denied. So that was one big one. The other relates to drug costs. So in 2007, Medicare did not pay for all of drug costs, and there was a very significant kind of they called it the donut hole, where if you made over, they'd pay for the first couple thousand, and then they wouldn't pay for about the next 5,000 of medication costs. And so that's been closed, but you can still have copays on your medications, and so that can be very expensive. And getting back to the kind of tipping healthcare part of it, healthcare is just incredibly expensive, and how do you deal with that? And so one of the other scenes in the movie was the patient with cancer. A very sad story and very, very touching. The husband had, I believe it was renal cancer. And
are you talking about the one where the husband actually dies of cancer?
Yes.
Yeah, later in the movie.
Right. Yeah, he actually passed away. So you see him before and after. It's like, geez, it's just tragic. And but the costs of medications are extremely expensive, and some of it, how do we wrestle with those issues as a society? And So weight loss drugs, Wegovy and Mounjaro and Ozempic, huge business. They're 15,000 a year. So, and if you weigh, if your BMI is 30 or more, which 45% of the United States is at, you're eligible to, you would meet criteria. So do we have enough money for 45% of the population to get these weight loss drugs? And how do you kind of control that? And if cost is not a consideration, then anything goes. But if you try and put some, if you want to make rational decisions, I think you have to take cost into consideration. And that's why I fundamentally believe in value-based care. And in the movie, there's a section about HMOs, and a lot of truth to it. But at some level, I think it is important for us to think about cost. And if we're spending it all on healthcare, we're not necessarily going to spend it on, say, education or job training or providing walking trails in impoverished neighborhoods, et cetera. There's opportunity costs that are related to that. And I just think that the more we can make kind of rational decisions about where and how we spend our dollars, the better off we'll be. And I think managed care is a step in that direction.
What is an HMO exactly?
Well, HMO stands for Health Maintenance Organization, and what it really was about is really analogous to managed care plan, and
Right.
the main differentiation is that in an HMO there is the incentive, you get paid X amount of money per patient to take care of them, a per member per month. So the incentive is to control costs. Whereas in the traditional fee-for-service or commercial insurance, it's just kind of a cost plus. Whatever you spend, the more you spend, that's fine, because the health insurance company is going to get their 5%. So the more that spent, no one cared. The doctor got more, patient got whatever they wanted, the insurance company got their piece. So you just saw these rapidly rising healthcare costs, and why our healthcare costs are contributed to why costs in the United States are higher than anywhere else. And so in managed care and HMOs, instead of that, it was like, okay, no, we're going to say you're going to get paid a certain amount per member. And there's a lot of factors that go into that. And one of them is, well, what if you have a group of healthy patients, you're going to do great. And what if you have a bunch of sick patients? And so you get into issues like that, and how do you risk stratify? And I talk about some of these issues in tipping healthcare, and just like everything else, the rich get richer, and the healthcare providers who are taking care of more indigent patients tend to suffer when it comes to those kind of systems. And that's the fundamental difference: is you're paid a per member per month amount as opposed to a fee for service, and so the incentive is to reduce costs or to control costs in an HMO. In a traditional fee-for-service system, the more you do, the more you make.
Yeah, and I feel like one of the scenes that really stuck out to me was this C-SPAN clip of this woman who's confessing about what she says are wrongdoings as somebody representing HMOs. I just want to play this clip really quick because I think it's pretty powerful.
Dr. Linda Pino, a former medical reviewer at Humana.
My name is Linda Pino. I am here primarily today to make a public confession. In the spring of 1987, as a physician, I denied a man a necessary operation that would have saved his life and thus caused his death. No person and no group has held me accountable for this, because in fact what I did was I saved a company $500,000 for this. And furthermore, this particular act secured my reputation as a good medical director, and it ensured my continued advancement in the healthcare field. I went from making a few $100s a week as a medical reviewer to an escalating six-figure income as a physician executive. In all my work, I had one primary duty, and that was to use my medical expertise for the financial benefit of the organization for which I worked. And I was told repeatedly that I was not denying care, I was simply denying payment. I know how managed care maims and kills patients. So I'm here to tell you about the dirty work of managed care. And I'm haunted by the thousands of pieces of paper in which I have written that deadly word, denied. Thank you.
How did we get to the point of doctors at health insurance companies actually being responsible for the deaths of patients? Who invented this system? How did this all begin?
What's your reaction to a clip like that, John?
Well, it's powerful, and there's certainly the potential, and more than the potential, their abuses have occurred, and so you need to have regulations and guardrails around the system, and just like there's abuses in the fee-for-service system where people, can called churning patients, or any number of ways where you can just jack up the cost of care, and in ways that are unethical. There's the potential for denying services in an unethical manner as well. But I think there's a lot stricter and more rigorous oversight of that process now than there was back then. I wasn't involved on that aspect of it at that time, so it's hard for me to say. I will say that that's part of what we call utilization management, and maybe that's the euphemism for it. But there's various guidelines and standards about what's covered and what's not. There's experimental type things that are not covered. It's a dynamic process. So, like one example, the weight loss drugs is one. So is everyone with a BMI over 30? Do they get $15,000 worth of medicine every year? And then we could do a CT scan, what's called a whole body CT scan. So let's CT scan you from up to down. We may find something. We may have missed a cancer if we didn't do that. Well, maybe that occurs in 1 in 1,000 people. And maybe in 100 of those people, you find something that was totally fine, and you end up doing a biopsy and causing expense and worry and anxiety unnecessarily. And so, we have the capability to do any number of things, but I think it's legitimate to say that we have limits on our resources and our capabilities. So some type of utilization process, I think, is necessary and is important. But there does need to be guardrails on that. And the more that we kind of are clear and explicit about those kind of things, I think the better off we'll be. And, you run into these issues too, like end of life issues, where someone is 85 years old and, it's grandma, grandpa, your mom, your dad, your brother. It's very personal decisions. And you could either do, if he's having trouble breathing, perhaps we could intubate him, put him on a ventilator, and we can provide him antibiotics and put him in the ICU, and maybe he'll get better, or maybe he's got cancer and it's spread throughout his abdomen, his peritoneum. Well, we have this chemo this treatment that last resort. It may work, may not. Really tough decisions, and not purely medical decisions. So there's always things we can do medically. I think, and I talk about this in the book a little bit, that making a purely medical decision I think is an injustice to the patients and family, as well as to physicians, and to us as a society, that these issues go beyond just the purely medical. Yes, you can do more. You can always do more. But can you provide them with a more dignified way to live out their last few days? And we can't predict the future with 100% certainty. There's always going to be that doubt. We're never going to know for sure. We can say in general, this is what we can predict. It's unlikely to, your dad is unlikely to ever be the person he was again. And perhaps we should be looking at how we can let him come home with you, be cared for in the family, make sure that that you and your family have all the support you need at home, as opposed to spending $100,000 on in an ICU visit for those last 2 weeks. So, just really kind of tough decisions. Yeah, and it's easy to portray them as, oh, you're withholding care. Well, I think there's more to it, and I think it does a disservice on either side to do that. We saw that with talking about end of life as being death panels. Well, let's give patients the options and families the options. Let them understand, and let's really support those who don't want to have everything done, or just let them know that we can make sure that you have a nurse there full time or readily available. Your family member, loved one is going to be well cared for in the house. We're going to give you all the support you need during these times. There's other ways to approach this, and in a more, I think, humanistic manner.
Yeah, well, I guess I was thinking about how Michael Moore in the movie Sicko, he kind of portrays America's healthcare system as like a symptom or a part of like just like the whole capitalism kind of structure, and how the way that it's gotten so corrupt and bad is because it just benefits the people at the top, and they can make a shitload of money the way it's set up right now. And obviously the movie makes after this is Capitalism, a love story. So he delves deeper into the issue of how capitalism kind of, is destructive and to the average American. And yeah, I guess, yeah, part of me wonders like, can healthcare escape the traps of capitalism?
Yeah. I think it's hard to fight Mother Nature and human nature. And I think a pretty consistent rule of thumb is people are going to act in their own best interest. They can frame it in a lot of different ways, but they're going to do what they think is best for them. And
well, however, there is that guy in the movie, Tony Benn, who is the like kind of the British spokesman, and says that the reason that the national healthcare system was created was because of like democracy and this like kind of freedom of choice.
When did this whole idea that every British citizen should have a right to health care?
Well, if you go back, it all began with democracy. Before we had the vote, all the power was in the hand of rich people. If you had money, you could get health care, education, look after yourself when you were old. And what democracy did was to give the poor the vote, and it moved power from the marketplace to the polling station, from the wallet to the ballot. And what people said was very simple. They said in the 1930s we had mass unemployment, but we don't have unemployment during the war. If you can have full employment by killing Germans, why can't you have full employment by building hospitals, building schools, recruiting nurses, recruiting teachers? If you can find money to kill people, you can find money to help people.
Right.
People kind of like tie our democracy with capitalism a lot, but all of these other countries that have nationalized health services are also democracies. So it's like, why is our nature so much greedier than all of these other countries? Because they have the same freedoms as we do, more or less. So why is it that America is so lopsided, especially in this regard?
That's a fair question. America, rugged individualism and all that, and pull yourself up by the bootstraps. Your grandma, my mom, talks about Canada. We've got our cabin up there that we love to go to in the McGregor Bay, and but she says, Canadians, they just want to be good enough. They don't have to be number one. They just want to be good enough. And maybe that is part of it, a different mindset, and more of a mindset of trying to benefit your community as opposed to the individual. And you make a good point. Where does that come from? This sense that we're better if rising tide lifts all boats. If we can contribute to help everyone, it helps us. And I guess I'm just speaking from my experience in the United States, where people act in their own best interest. And I think would joke about it. My career as a medical educator and the director of a residency program, and I could predict with 100% certainty how residents would respond to any suggestion about a change in the curriculum based on whether it would ultimately result in more work or less work. And it would be framed in a lot of different ways, but that's what it would boil down to. And
Like if this mean like we want to help people, so that's going to mean a little extra effort on your part, and then immediately they just shoot it down.
if it's going to result in more work versus less work, yeah, but it would
Wow.
be, again, I think framed in different ways, and I don't think residents are any different than anybody else, and
So we're greedy and we're lazy.
yeah, there you go. But I think you can build it in to address those issues. Okay, well, we're gonna staff for that. We're gonna put in processes so somebody's got a job to do these kind of things. And so I think there's ways to get around it. But why, what is fundamentally different between us and other countries? That's a really interesting question. And even more dramatic was in Cuba. Where they, the scene where they go to and
where Michael Moore, he takes a boat from Miami, boat filled with a bunch of people looking for healthcare, tries to take them to Guantanamo Bay, which we find out has basically universal healthcare for all of the detainees there. So, that's kind of his big
stunt.
Yeah, his big stunt. Yeah, that's
there
the
go.
word. Yeah.
Yeah, and it was great. It's really powerful. I mean, he was taking folks who were at 911, who
At
first
Ground Zero.
responders who have their lungs blown away by all the dust and asbestos or whatever that they inhaled trying to rescue people, and couldn't get the health care they need in the United States. How tragic, these heroes, and having to go to Cuba, just how ironic. So that was a really powerful segment of the movie, and a lot of truth to it. I have worked in correctional settings, and that is the only place in the United States where you are guaranteed a right to health care is in jail. So
that's wild.
Not a reason to be there, a terrible place to be. But it is true that you are guaranteed health care when you're incarcerated, because you don't have any options. You're locked up where you were basically taking responsibility. We as a society are taking responsibility for your well-being.
But it's not like great healthcare, right? I mean, like he kind of portrays it like
No,
Guantanamo Bay is like, this like heaven,
yeah,
of healthcare. I don't know if that's accurate or not.
Yeah, well, it gets back to your point about a Medicare for all. And if you truly had a universal system, you would organize it in a more efficient way. So we want to make sure that we can provide care in all these different settings and the basic level of services. And he made the point well that in Cuba, they don't have nearly as much money, and they spend a lot less money on healthcare than we do, but it's organized to address the largest population. So in a way, it's, how do you more efficiently and effectively provide services to the population you're serving? And so they provide the basic things. They provide primary care, and they have the basic kind of tools to take care of folks. And, they probably struggle with that patient with metastatic cancer, getting them the care they need, or the care that we would perhaps expect in the United States. So, something's going to give. But, they've made the decision to provide a solid basic level of service to everyone. And those are the kind of decisions I think we should make. And if we did, there would be more emphasis, more spending on public health type interventions than there is on individual healthcare services.
Yeah. I'd like to switch gears just a little bit and just talk more about like kind of the cinema of this movie, just the construction of it, because I think that what Michael Moore does, and he's very vocal about this, that he's talking about hard-hitting topics, but in the end, he's just a filmmaker, and he's trying to make an entertaining film, which I think he does probably better than any documentarian. I wouldn't say that he's the best documentarian. I think there's different styles of making a documentary film. You've got your Herzogs, you've got your Wisemans, you've got Michael Moore, who, really tries to make widely appealing and kind of consumable documentaries. And I just don't think that anybody does it quite like he does. Watching this, I was like, man, it really kind of feels like a horror movie the way he starts it off, where you got this guy who's like sewing up his knee and
Oh yeah.
and like you got this guy who's like doing self surgery basically and like stitching up a like a deep cut on his knee. And then you've got this other guy who like cuts off the tips of his fingers and is kind of like deciding which finger to keep because one like his middle finger costs $60,000 and his ring finger costs $12,000, and he goes with the ring finger, and Michael Moore is kind of like his other finger went to the dump and it cuts to like seagulls like pecking at a dump.
Yeah.
And I don't know, I just think he does such a great job of just wavering from like really funny to really tragic, and he does it so seamlessly somehow.
Well, it starts with the George W. Bush clip, right? Like that's the very
Right, yeah.
first thing.
The OGBYNs sharing their love with women. Yeah, I mean, like he was the George Bush critic back then. He can't help himself but to stick it
Yeah.
to GWB.
Yeah, picking up where Fahrenheit 9/11 left off. Yeah, I did think it was interesting how like the first 45 minutes of this movie, like Michael Moore really isn't in the movie. I was like
Hmm.
noticing it's just like you just hear his voice. And I was like, oh, is he like not like gonna be on camera in this movie? But then like after like yeah, I think I like check the time code. It was around 45 minutes. Like he like starts inserting himself in there, which I just thought was kind of an interesting choice to
Hmm.
for him to like step back and like not really be in the first chunk of this movie and just kind of show the people that are affected and stuff. But I thought it was a good way to pull you in. But yeah, then he's back to his old ways of being on camera and talking to people and
Hmm.
yeah, being goofy with people.
Yeah, I mean, he's such a presence though. His narration is so strong. The way that he like kind of speaks in these like low kind of docile tones and really just kind of pulls you along. The way that it starts, I think, is just so brilliant with just like showing like here's an example of a victim, here's an example of a victim, and you're just like bam, 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 bam. Within the first 10 minutes of this movie, you're introduced to like a dozen people and a dozen different stories, and he does it in such a rapid pace that you're really drawn into all these different people's stories, and he himself is kind of in the background the whole time, and even his like just his humor is always present. Like when you were talking about that yeast infection thing, where it's just like she had a yeast infection, and then it like there's like a hawk scream in the background,
Yeah.
and like the music like dun dun dun, you know.
Yeah, he's great at using music throughout the whole movie. Like he uses like goofy, kind of like old-timey music at times. And I don't know, helps with the tone of the movie to make it not feel completely dour and bleak for two
Mhm.
hours. Like he manages to like inject some energy in there with music and his montages and yeah, it's more entertaining watch than I was expecting. I was like, oh, this is I've seen this movie before when it came out, but yeah, revisiting it, I was like, yeah, I forgot how well he is at kind of pulling you along, Michael Moore,
Mhm.
keeps it
Yeah,
entertaining even if it is some tough material.
definitely keeps you engaged. I watched it with Grandma Ruth, and she stayed awake the whole time. And yeah,
Oh,
no,
you
he's
watched it with Grandma yesterday?
it was a few weeks when I was back in Michigan. That
Oh,
was
nice.
few weeks ago, and but yeah, no, very engaging, and yeah. So as a movie experience, I enjoyed it. I was riveted, and he just has a persona that you're that yeah draws you in. Very engaging and kind of that wry sense of humor. You're always kind of impish, kind of mischievous
Hmm.
nature, but very sly as well, and but powerful. Yeah. So
Yeah.
I thought he did a great job of highlighting important important issues in a way that people can relate to.
Yeah, it's interesting how I feel like, this movie, he's not confronting his villains as directly as he does in his other movies, because I think by this point, he'd won the Oscar. Fahrenheit 9/11 was like a huge, huge success. Like he even says it in the movie where one of the guys like contacted his health insurance thing. And he's like, "Hey, I've been talking to Michael Moore, and you better do this or you're going to be a part of the story." And sure enough, they like fulfill his request right away because they don't want to, be in a Michael Moore documentary as one of his villains.
It's funny they're in the documentary anyway.
Yeah.
Yeah, it's like they didn't avoid it.
So he had a show back in the 90s called The Awful Truth, and he was going after HMOs back then. And it's this really great segment where he's talking to this guy who has pancreatic cancer. His doctor says, he can die any day, but Humana just keeps denying him care for his insurance because they're saying that his condition is a pre-existing condition, so they keep denying him, and they keep saying that we need to like do more research. And so Michael Moore and him like go to Humana to talk to the vice president or something, and they go there with a hearse and invitations to the guy's future funeral, and like handing out these like invitations to everybody there, being like, he can die any day now. You're invited to the funeral for when he dies. And again, like pulling these stunts, but very, very directly, like walking into those buildings and confronting these people. He doesn't do that as much here because I think that his celebrity was a little bit bigger, but it doesn't detract, I think, at all from the power of this. I mean, I think if anything, it kind of maybe a little bit easier to swallow when it's like not so much like Michael Moore's front and center. I mean, some people are irritated by him in that way, like how he inserts himself. I don't know how you guys feel about that.
Well, he was very much enjoying himself in Canada and in France and in England. He seemed like he was at home, and they were just very kind of upbeat, uplifting segments. And it's like, oh man, what are we missing out on?
Yeah. Definitely makes you want to move to France.
Yeah, I don't know. I don't really have a problem with it so much. It's just his style of documentary. And yeah, it's interesting. I feel like his movies were like the first documentary films I ever saw.
Right.
So like when I got more into watching other documentaries, I was like, well, why isn't the filmmaker in there? It's like, isn't that how you make documentaries? Like I thought like the Michael Moore way is like that's like the standard method, is like the documentarians like kind of in the movie. But yeah, I've seen a lot more now and understand there's many ways to make a documentary, and his movies, they feel more like kind of like video essays more than like portraying the truth, because he's coming in with a point of view and he's trying to make a statement typically.
Right.
So, he's structuring his argument, and yeah, that's how his documentaries go. And I feel like they're usually pretty effective. I haven't watched his most recent movies. I feel like I watched Capitalism: A Love Story, I think was the last one I watched, and I haven't seen Fahrenheit 11/9 or Michael Moore and Trumpland or Where to Invade Next. I don't know. Have you guys seen those?
No.
Yeah, I've seen them. Where to Invade Next is pretty cool. It's very similar to Sicko in that he goes to various different countries, and basically the conceit is, we invade all these other countries to like conquer them. It's like, why don't we steal some ideas from other countries? So, stealing like the healthcare ideas from France or from Britain. Michael Moore in Trumpland is actually just a speech that he gave in 2016, right before the election, where he basically predicts extremely accurately that like Trump is going to win in 2016, just basically saying like, hey, I'm from Michigan. I know who these people are. I know these blue collar people who are sick of the system. And he's speaking directly to those folks. And of course, Trump won Michigan in 2016 and won the election. So he saw it coming. He knew what was up. And so then Fahrenheit 11/9 is like basically his Trump movie, like just talking about, how insane it is that Trump is a president. I didn't find it as effective as some of his other ones because it's just kind of like him kind of venting about Trumpism, and it's still good. I saw it in the theater when it first came out. I was really excited to see it, but yeah, wasn't as impressed, but still good.
Yeah, that was back in 2018, and it doesn't look like it's like anything in the works right now,
Mm-mm.
as far as I can tell. So I just saw him on MSNBC. I saw a clip of him from like 6 days ago as of this recording, and him kind of venting about the embryo being considered like people thing and like turning it into a whole bit.
Mm-hmm.
That was kind of
It was
funny.
like, keep it down. Like
Yeah.
I saw that, yeah. And he's like talking about, oh yeah, there's all these embryos in my hallway. They keep talking. And like,
Yeah.
yeah, I mean, it's an election year, so he certainly is going to be coming out. Yeah, I mean, Michael Moore, I kind of alluded to it in the beginning, but Michael Moore is very inspirational to me. I remember seeing Bowling for Columbine in school, actually. Like I remember the teacher rolling in the old VCR TV, and we watched Bowling for Columbine over a few days. And it totally changed my view of guns, and it's a view that I still hold. And which we know, Grandpa, treated gun violence as a health issue. And I look at him as kind of a North Star in terms of like being sort of a pop documentarian.
Yeah.
Well, and able to reach a much larger audience because he does have that way of making it entertaining, interesting, riveting. That it's him. There's something about his personality. He's very, it's
Mm-hmm.
just very witty, insightful, sardonic. All those things
Mm-hmm.
that just you want to hear what he has to say and how he says it, and just his appearance. Kind of just kind of big bear of a guy. But
Yeah, I mean, I was thinking
but
about that. Like when there's that scene where he's like sitting at the dinner table with all the French like expats, and he's kind of like, this big American dude, like with the
right,
hat on in this like
You're dressed all
fancy French,
schlubby. Yeah.
yeah,
yeah.
in this like fancy French restaurant. Like I'm like, man, he is just like such a perfect like
Yeah,
icon
yeah.
for like the American, like the
Mhm.
classic American. Like it really makes sense. I don't know if any other kind of documentarian can really get away with like speaking about American issues from his perspective without like looking and sounding the way that he does, because he just like he really does sort of like visually and spiritually like represent like the average American Joe.
He always took that really seriously, thinking back to his days in Flint. I mean, that was his identity, was the working class person, and he's never strayed from that. Yeah,
Hmm.
but hearing you talk about seeing that movie in school, could you imagine that today? If
I
somebody
know.
showed Bowling for Columbine in a school, that this kind of thought purity or whatever, and they
So
boy,
true. So
and
true.
sure don't do that in Florida. So boy,
Yeah. I
Hmm.
mean, they should. I mean,
scary stuff.
Bowling for Columbine is like one of my favorite movies of all time, period. And I saw Fahrenheit 9/11 at the Michigan Theater opening day in Ann Arbor when it first came out in like whatever that was, 2005. And I remember like just being so energized by it and just being so furious at the Bush administration.
And now he's a liberal Republican.
Right, yeah, yeah. Now he's like looked at as like moderate. Yeah.
Right. Incredible where we are. We're closer to Nazism than we are to showing thoughtful movies in classrooms.
Right. What are some scenes that stick out to you guys like from this movie? Like what are some scenes that you really like? I was just looking over my notes and I remember there's that incredible scene of that Beatles fan trying to do a handstand on Abbey Road and breaking his shoulder.
Yeah, they got video like immediately, like fucks up his shoulder.
So good. I mean, like the comedy in this movie is just like it's just remarkable. Again, I know I already said this, but it's just remarkable how he can just switch the gears on a dime. It's like you'll hear the most tragic story of somebody like not being able to provide health care to their like dying daughter, and then it just like on a dime just switches to like some funny scene of a guy like breaking his arm on Abbey Road.
Yeah, and somehow it doesn't feel that jarring.
Mm-hmm.
He makes the transitions pretty tolerable.
Mm-hmm.
I like the montage of him walking around France set to that Je t'aime song. I just really like
Mm.
that song. I just thought that was a fun musical choice. I also like the mother with her weird looking French baby with that the baby's hair is just like
Yeah.
super wild. I was like, this is like one of the craziest looking babies I've ever seen.
Where she's like, "Oh, you don't have people who do laundry for you? Like, it must be
It's
so
like
hard."
it's like and yeah, she'll make pureed carrots for me if I want.
She's like right there. She's like, "Would you do it?" And she's like, "Yeah, sure, I'll do it."
Yeah.
Well, that's a big part of humor is just, catching you off guard, unexpected, and he's just a master of that, of just kind of
Hmm.
sneaking them in.
He's walking around that British hospital, like
Hmm.
looking for a bill, and he's
Yeah.
like asking everybody, like, "How much does this cost you?" And they're all just like laughing at him, like, "No, doesn't cost us anything." And
Yeah.
then like he finds out that they actually get money from a guy like in the basement who's just like handing out cash for people to get home safely.
Yeah.
I mean, unbelievable.
Well, that's an example of something that is becoming more established, that offering transportation for services.
Mm,
Again, we are making progress in some areas, and recognizing that it's important to address some of these infrastructure components.
yeah. What about that scene where they, and again, like going back to like the horror element of this movie, there's that terrifying shot of the woman being just dropped off from a hospital in front of like
Mm.
in front, what is it, like a YMCA or something like that, or it's like
Yeah, patient dumping.
yeah, and like there's and just the way that they show that security cam footage of this like woman in a hospital gown just like wandering around the streets. It's just like looks like something out of like The Ring or something. It's like
Yeah.
very unsettling.
Yeah.
Well, when I was a kid, I remember going to Ypsilanti State Hospital. I think it was closed by the time you guys grew up, but it's where, folks who had schizophrenia and severe mental illness were kept, basically warehoused in a really ugly place. And as a kid, the smell, just there's something about it was really difficult to stomach. But So now we've closed the Ypsilanti State Hospitals of the world, and schizophrenics are on the street. They're either on the street or they're in jail. Is that a better system? Huge issues with that in terms of how to, kind of humanely assist those who are out of touch with reality. And then, there's issues with substance use, et cetera, that can also contribute, homelessness, a lot of different factors. And folks who are homeless, they often will go to the emergency room because it's a warm place to be. So it drives up healthcare costs astronomically, not to mention the healthcare issues that they develop, being out on the streets and vulnerable. Um, and what is the role of our healthcare system in addressing this social determinant of health? And my feeling on that, and I talk about it in Tipping Healthcare, is that, as a healthcare system, we should really focus on healthcare. That's our expertise. How do you take care of patients? How do you the hospitalized patients? How hospitals are good at that, ICUs, et cetera. Housing is not our expertise, uh, and so it certainly has an impact on healthcare. But is that the responsibility of the healthcare system? And I don't. I think there's a responsibility to identify it and to connect them to the resources that are there. So, screen for it, screen for social determinants, make sure they're plugged into the services, and that's where this network of community health workers comes in. But to actually provide the housing, I think that's a separate issue. And it's so when thinking about at a societal level, thinking about housing, and we need to have a more systematic approach to that as well. Absolutely. But that is not the sole responsibility of our healthcare system. Now, if we had better housing for everyone, probably healthcare would cost less. So could you ask healthcare to somehow subsidize, or do we take money away from healthcare industry to support some of these other kind of social services? Well, yeah, no, I think you do have a good argument there, but for health, to expect the hospitals, et cetera, to directly address that, it's just a complicated issue.
Yeah, but I mean, you've got examples in this movie, and I know that it's still true today, is that people are losing their houses because they have to pay for their health care. It's like they're literally forfeiting their housing for their health.
Yeah. And then, so that gets back to the Medicare for all. We should have a universal healthcare system. People should not be in that situation of not being able to afford care. And then, as a society, we need to say, okay, how do you define what healthcare is, and what is it that we as a society can afford? And we may evolve in our perspective of that. But if we had a Medicare for all system, that would not be happening.
So is it legal to do that patient dumping, or do people still do that?
They need to be stable for discharge.
But
And
just throwing
if
someone on the street with a hospital gown, and like there's that one example of that woman who's got like stitches in her head still, like, that sort of stuff is still happening.
There's less of that, but I think it does still happen to some degree. Folks are homeless. Where are they gonna go? They may be given a voucher for a taxi or something like that. And what if they don't want to go to the local rescue mission? That's a challenge. I'm sure there are abuses in different places. I mean, you've got folks who cross the border and are put on a bus to Denver or Chicago, so right. Is that migrant dumping, so what's legal, what's not. Their housing is clearly a huge issue in our society in California, and it's a major challenge, and it's not just an issue for healthcare, but it certainly impacts healthcare, and we need to be part of the solution. And one of the things I talk about regarding social determinants of health is there are so many different entities that play a role. So as a doctor, you're supposed to, take care of your patients and make sure they get what they need. Hospitals are supposed to provide community benefits, so they have a role. Managed care plans also, there are some expectations, but government is supposed to be providing housing as well. And then community-based organizations are out there doing their thing. So there's all these different entities that have a role, and who takes the lead in addressing this. And again, that's where I think looking at it at a community level, how do we best integrate those services to, kind of get the most bang for our buck to, meet the needs. We could spend a lot of time talking about housing. We need a different movie about that one, about an unhoused person, and to talk about that.
Yeah. One of the statistics that Michael Morse throws out there in the very beginning of the movie is that there's 50 million people without health insurance, and 18,000 people will die because they don't have health insurance that year. Do you think that number has gone up since 2007?
No, it's gone down for sure. And that is where the Affordable Care Act made a big difference. So, it basically provided major coverage. Now, you have to pay for it. So, and in fact, everybody is required to have health insurance now. So when you file your taxes, you're supposed to submit a verification of your insurance.
Right.
So you are required to purchase health care. So it's dropped. That number has dropped a lot, and I think it's probably more like 4 or 5%. And but then you see, different states. Medi-Cal is out there, and or Medicaid, and so that's healthcare for folks who don't have enough, who are below the poverty level. But some states it's covered up to say 200%, some other states 300%. And if the states don't pick that up, then there's those folks who are don't have coverage or have to purchase their own coverage and just can't afford it. But the number of folks who don't have insurance, I think, is much less than it was. But still, there's the issues of copays and deductibles are very, very real, and absolutely impacts decision making about getting your fingers sewed back on.
Jeez.
All right. Well, should we do our final thoughts on the movie here?
Yeah, so I mean, I just think Michael Moore is a master documentarian. Again, I don't think that his style is necessarily the best style. I love Errol Morris. I love all kinds of different types of documentary, like, D.A. Pennebaker with like Cinema Verite or whatever. This is very much, I don't know, you could go as far as to say that this is kind of a propaganda film, because it's from a certain point of view, and it's not compromising in that point of view, and will do anything kind of to manipulate your audience to see his side of things. But I think it's, in the end, I think it's for altruistic purposes. I think he's just doing a service, kind of, to just be like, hey, this is my point of view, and take it or leave it. I just think he does such a great job of portraying different people. All the profiles in this movie are great, and I just think it's funny as hell too. Like, I was cracking up when that like Star Wars list of diseases like started going across the Star Wars scroll of like things that you can be denied healthcare for. And then it just like cuts off like really quick, and then it goes straight to a woman who's like crying about how she had to deny people healthcare. And just, again, that just yin and yang of this movie, it just is so seamless. Yeah, I mean, I love it. I think it's a great film. And yeah, I mean, I'm really grateful to have your perspective here, Uncle John, on it.
Yeah. Yeah, I enjoyed revisiting it as well. I remember it being very illuminating to me seeing this movie when I was in high school. Not really, not an adult really, but unaware of how how bleak things could be out there. So this was very illuminating at the time for me. The scary world of hospitals and health insurance and all that. I was like, whoa, this doesn't seem great. And I feel like it does a good job of painting that picture. Yeah, I like Michael Moore. He seems like a very empathetic kind of guy. He really feels for the people that are less fortunate. And as a Michigander, I have some kinship with him. And an MSU alum.
Mm-hmm.
Yeah, so I'm on Michael Moore's side. I did feel like maybe a little exhausted near the end, or I don't know, just I feel like he spends maybe a little too much time like praising all the other countries. Like I feel like I was like, all right, I get it. You can maybe shorten this chunk of the movie, this second half of the movie up a little bit.
Yeah.
But I mean, I think it is important to show the other countries and how they handle things, and that it's completely reasonable to have a healthcare system that works. It's not like a fucking fantasy idea. It's a very tangible thing has been achieved by multiple other places in the world, even Cuba. which doesn't have a ton of resources, can manage it. So yeah, I think he builds his case well. And I like the ending with the "Don't be shy" because I love the nice Cat Stevens song.
I thought of you immediately when that song hit.
Yeah, I was like, I wonder if it's like the message of it is like trying to get people to take to the streets to like protest, like 'cause he has like that montage of like the French people doing a
Hmm.
bunch of protests and stuff, and like how like in America we're scared of the government, and government in France they're scared of their people, like that kind of thing. So it made me think it's like that kind of like the call to action there at the end of the movie to like for people to like be protesting about our healthcare system more. So yeah, I think that's an interesting note to leave on.
Also, the song right after the Cat Stevens song is a Tom Morello song that he wrote just for Sicko, the
Oh, really?
Rage Against the Machine's guitarist.
Yeah, I let the credits play out, and I liked all the songs that played during the credits. I mean, Michael Moore's got good taste in music,
Yeah.
some good needle drops.
Yeah. What are your final thoughts, Uncle John? Dr. John?
Well, as a movie, it was a enjoyable experience. It definitely he kept me glued the whole time, and I was riveted and was waiting to hear what was going to happen next. And unlike Oppenheimer, it was like, man, that was I was with it through the whole movie. I liked the final scene, the whole going to Cuba in that boat and evading the patrols and just with this boatload of heroes from 9/11 with these healthcare illnesses. What a only Michael Moore could have thought of that. And then getting there and getting to Cuba, and he can't even talk about how he did it.
Hmm.
And they actually get healthcare services and they're well received. And then these 9/11 first responders meeting their counterparts in Cuba, I thought was just, it was very powerful in that there's a common humanity, and if we could just somehow break through that a little bit and see that even these crusty firemen from New York City could relate to these proletariat from Cuba, that they have a lot in common and have a lot to give to each other, and was a really, really strong message. And Michael Moore, he certainly paints things in a very dramatic fashion, and I think overly dramatic in some ways. And so that would be my one criticism, and it feels heavy-handed at times. Uh, in the healthcare parts of it, absolutely illuminating major issues. But as I've said, I'm kind of a believer in some type of a value-based care system, managed care system, where we do think more rationally about healthcare costs and how we can provide it in the most efficient and effective manner. I think that's a reality, and the sooner we embrace that, the better. And I think we could tip healthcare in the right direction by creating such a system and addressing social determinants and increasing access for folks by being thoughtful about how we spend our healthcare dollars.
Yeah,
Awesome.
check out Tipping Healthcare 2024 by John Zweifler. They'll be out by the time this episode
Yeah, it's an
drops.
ebook and be available on Amazon for sure. Yeah, and, thank you for having me and letting me talk about it. And boy, we could spend another couple hours on some of the other chapters.
Yeah, thank you for joining us, and we'll drop a link in the description to the book if anybody's interested in picking it up. Dr. John Zweifler, Uncle John, Uncle Chili Peppers, thank you for joining us to talk about Sicko and tell us more about your book, Tipping Healthcare.
Thank you. It's great seeing both of you. You guys just do a fantastic job. I enjoy listening to all the different episodes. I was backtracking a little bit and listening to Scout, and yeah, you guys just do such a nice job and keeping it light and but interesting and informative. So yeah, thanks for asking me to be part of it.
Thanks.
Thank you. We love to hear some nice words about film with family. Keeps us going.
And we'd like to thank our listeners for listening to this episode of Film with Family.
Yes, you can follow us on Instagram, Facebook, and YouTube at Film with Family. See what we're posting on there.
And if you'd like to send us an email, tell us about your healthcare horror stories, send us an email at filmwithfamilypodcast@gmail.com.
And you can also subscribe to us on Patreon, Film with Family Extended Family, for $1.99 a month, and you get a bonus episode every month.
We're still continuing our Oscar Best Picture winner family films, and this month I believe we'll be doing Rain Man.
Yes. So yeah, that's a fun way to get some extra content out of us, and a great way to support the podcast to keep us going.
And stay tuned. In a couple of weeks, we'll be talking to my good friend and TikTok star, Ross Childs. We'll be talking about Blazing Saddles, Mel Brooks' classic film.
Nice. That's going to be a fun episode.
Uncle John, thanks again. Check out Tipping Healthcare at your nearest bookstore or your nearest ebook.
Yes, all virtual. Digital solutions.
So this is purely ebook. It's not going to be in print.
Early ebook.
Okay, maybe we should say that.
Just on Amazon ebook. We don't have to cut down any more trees. More efficient and effective. There you go.
Healthy for the world as well.
Yeah. Well, we're proud of you for putting it out there.
Yeah.
Cool to have a published author in the family.
There you go.
Austin, we love the movies.
And Zach, we love our family.
Thanks for listening. See ya.
Bye-bye.
Bye, everyone.